Epione Pain Management Center. ఇక్కడ మీ నొప్పులు శాశ్వతం కావు.
Knee joint pain is not so uncommon. After the age of 40, everyone will go through this process of degeneration happening in your knee joint. For some patients, the pain, the symptoms may start as early as 45-50, and for some patients, it may not start up to the age of 80-85. When I see in my OPD, I get a varied difference, especially in young females. I see now we have seen young females at the age of 38-40 coming to me with knee joint pain. And sometimes, to my surprise, a lot of old patients, they are very happy till 80-85 and then they start getting the pain. Now, this is something which is not under our control because it depends upon a lot of other things like your metabolic activities, your body weight, your general daily activities, your genetic build-up, and the kind of weight you have. But definitely what we can make sure is once your knee joint pain has started, to take all the precautions what is needed to delay the onset of osteoarthritis. Osteoarthritis is just an aging condition where the cartilage will start degenerating, and it progresses from stage 1 to 2 to 2, 3 and then 4. Now, how you maintain your daily lifestyle, how you take care of your knee joint is very important so that we prolong the period where it progresses from stage 1 to stage 4. Now, having said that, whatever stage it is, you need to take care of yourself. And the best way of getting rid of this knee joint pain is by doing platelet-rich plasma therapy or regenerative therapy. During this process of osteoarthritis, you may have pain, you may have stiffness, your joint movements may be restricted, climbing stairs up and down may be painful, sitting on the floor may be painful. Most commonly, getting up from sitting position is painful. So these are the symptoms which most of my patients will come. Now, when I do platelet-rich plasma therapy, I am just taking your blood and forming growth factors and injecting for cartilage growth. Now, this cartilage growth, what I am doing with PRP is going to happen. But what are the other symptoms that the patient is suffering with? Like the stiffness of the muscles, the restriction of the joint movement, the daily activities become painful, climbing stairs become painful. So is only PRP going to take care of this is a big question. So we at Epione Pain Management Center, after treating more than 50,000 patients, realized there are still more to go ahead and do it to give patients a better result. And so we came up with this protocol where we do platelet-rich plasma therapy followed by movement of the joint to be assessed and to improve by doing a continuous passive motion exercises with the help of CPM machine through a specialized team of physiotherapists and rehab specialists, taking care of the bone health, because if the bones are weak, again the platelet-rich plasma therapy success is little less. So identifying what kind of bone it is, how are the bone mineral density, and how strong or weak is your bone, and then after assessing, trying to correct it. That can be done again with our nutritional specialist with some kind of supplements, and finally to make lifestyle modification so that the success of platelet-rich plasma therapy remains for a longer period of time. Now, this protocol has been started in Epione Pain Management Center. There are lots of centers practicing platelet-rich plasma therapy, but this is the protocol which is going to give us the best result, because after having treated 50,000 patients and giving more than 90 to 95% success rate, we are 100% sure we are the only pain management and regenerative center where we can take care of your pain to the best success rate.